Here's the truth about 3 dangerous lies that everyone should know about in regard to COVID-19. In this video, I'm going to do a simple calculation for you that'll reveal a stunning truth about COVID-19 that many experts have gotten wrong. Knowing this truth could save your life.
Nation being addicted.
Dr. Terry Shintani, Director of Preventive Medicine at One.
Hi, this is Dr. Shintani for your health. Please share this important information with your friends and family by subscribing to this channel and clicking on the bell for notifications and sending links to them by email or by social media. In this video, I'm going to show you how badly we've been misled about COVID-19 by the World Health Organization. Here's the truth about 3 big lies we've been told. Number 1, it's not contagious. On January 14th, the World Health Organization said that preliminary investigations conducted by the Chinese authorities have found no evidence of human-to-human transmission of the coronavirus. That was not true. The truth is that the COVID-19 is highly contagious. The problem is that the World Health Organization knew that it was contagious by December 31st, when scientists from Taiwan shared reports from a colleague in Wuhan who concluded that human-to-human transmission was already happening. But the World Health Organization, inexplicably or for political reasons, decided to ignore this warning. Even on January 23rd, they repeated this falsehood in connection with international transmission and failed to declare a global emergency. Lie number 2, you can't catch it from someone without symptoms. Even today, the World Health Organization suggests that it is difficult to catch it from someone without symptoms. Their current information says that the risk of catching COVID-19 from someone with no symptoms at all is very low. Let me show you how wrong this is and how contagious COVID appears to be even in asymptomatic people. On April 9th, sadly, the U.S. number of deaths passed the 16,000 death mark. You have to realize that those 16,691 people who died on that day had to have been infected some time ago. The best study on COVID-19 says that the median time from infection to death is about 23 days. This means that the 16,691 people who died on April 9th had to have been infected on average 23 days earlier. This would be around March 17th. The CDC reports that the death rate from COVID-19 is up to 3% of cases. This would mean that on March 17, we must have had over 500,000 people infected in order that there are over 16,000 deaths today. This is because 16,691 deaths is 3% of 556,367 infected people. On March 17th, we had discovered only 6,346 cases. In other words, we must have missed over 98% of all infected people, and we likely already had over 500,000 infections as early as March 17th, when we thought we had just over 6,000. The only way this is possible is that there are hundreds of thousands of asymptomatic carriers walking around in the U.S., not knowing that they are infected. This should tell you 2 things. Number 1, COVID-19 is very contagious. And number 2, you can catch it from someone without symptoms. This is in complete contradiction of the World Health Organization's positions. Several research papers are now agreeing with me. Before I get to the 3rd and biggest lie, I'd like you to spread the word about this important information to as many people as you can by subscribing, clicking on the bell for notifications, and sending a link to your friends and family through email and social media. The 3rd lie is that the average person doesn't need to wear a mask and that they don't work anyway to protect you from COVID-19. But when you look at the countries that are doing well, they're all wearing masks, including China. In recognizing this fact, the U.S. CDC has finally broken from the World Health Organization's recommendation and now recommends that cloth face coverings be used by the general public and to reserve the N95 masks for healthcare workers. The regular mask seems to do four important things. Number one, possibly most important of all, it'll prevent an asymptomatic carrier from spreading the disease. Number two, it'll give you some protection from aerosolized virus. Number three, it'll remind you not to touch your nose and your mouth. And number four, it will remind others to be careful. So the truth is that contrary to the misinformation of the World Health Organization, number one, COVID is very contagious. Number two, it can be transmitted by asymptomatic people. And three, wearing a simple mask may be very helpful because there's likely a massive pool of undetected asymptomatic carriers of COVID-19 in the United States. The important lesson here is that wearing masks, in addition to washing hands and surfaces, preferably with soap and water, along with social distancing, is going to be a major key to beating this pandemic and to this nation's recovery. For more tips on COVID-19 and how to stay healthy, subscribe to this channel, click the bell for notifications, and be sure to forward this to your friends and family through email and social media so that they too can learn the truth and stay healthy. This is Dr. Shintani for your health.